Good evening and welcome. My name is Dr. Stanley White. I'm the Senior Associate Dean for Student Affairs, as well as Campus Dean here on our campus in the Commonwealth of Dominica. I'd like to welcome everyone who's joining us online, and we're looking forward to a really good, informative and interactive session with you all. We're joined this afternoon by our founder and CEO, Dr. Arvin Bagherpour, who's going to tell you a little bit about his journey to this point at this table. Our academic dean, Chief Academic Officer, Dr. Amina Mahdi, and two of our students. And we want to make sure that they have sufficient time to give you their experience of how they've got here and what they're experiencing now. So there is a slide deck, I believe. Thank you. Okay, so basically, ACSOM is a non-profit school based here in the Commonwealth of Dominica, and non-profit status is extremely important to our mission. And we operate what we think is a state-of-the-art curriculum with a very differentiating quality over many other schools, which is small group, flipped approach learning, which is clinically relevant from the first day of teaching. One of the other really distinctive features of our program is that besides our almost exclusively MD faculty who are facilitating the small group teaching, we have a regular supply of top quality medical educators from a whole variety of top-notch schools in the USA who come down to us, spend a few days giving lectures to the students, but also developing career advisement sessions and other types of activity which the students can tell you a little bit about. We are a fully accredited ECFMG sponsor note medical school, and we'll probably say a little bit about that in the succeeding minutes of this webinar. Next slide. And as I mentioned, part of our non-profit status, as well as our basic ethos, which I think is our lifeblood at this school, is that we have a social mission. We want to produce physicians who are socially conscious, will be working in the communities in which they serve and making a difference. And we also do that by a community engagement project in Dominica, where the school is reaching out, working with healthcare partners, educational partners, to make a positive impact in the community in which we serve. So being a good corporate citizen is also absolutely vital to us. Next slide, please. So this last slide is simply giving you the details of our accreditation status. We are fully accredited by the IAAR for 5 years, and we have provisional accreditation from the ACSOM. Both of those organizations are World Federation of Medical Education approved accreditors. And we now are in possession, which can be verified on our World Directory of Medical School web entry, to have an ECFMG sponsor note, which is extremely important. And I'm sure Dr. Mahdi will say a little bit about that later. So with that, I'd like to hand over to Dr. Bagherpour, who will tell us all about his journey.
Thank you, Dr. White. Hello, everybody out there. Wish I was with you in person so I could talk, but it's great that we have the ability to talk here from Dominica with you all. I like to say that I went from from the Caribbean to Cleveland Clinic, and that's where I ended up graduating my fellowship from. I'm a vascular and interventional radiologist. I went to medical school at Ross University School of Medicine right here on this very campus in 2005, and I graduated in about 2009. I did a surgical internship at Beth Israel Hospital in New York City, which was a great experience. And from there, I did a radiology residency where I completed that at University of Texas in San Antonio. And then I went on to do a fellowship at Cleveland Clinic in what's called vascular interventional radiology. I'm a radiologist, but read imaging and various things like MRIs, X-rays, ultrasounds. But my subspecialty, my fellowship was in procedures. So using imaging equipment to do procedures inside people's bodies, like place stents or stop internal bleeding, do biopsies and various things like that. So the reason I like to tell that story is because that leads kind of the full circle of someone that, if you all are considering coming to a Caribbean medical school, I'm a person that lived it and went through it. From the first days of arriving here in Dominica, living here, and then going on to my clinical sites, which were scattered throughout the country. And we'll talk a little bit about those things and how it led to the creation of this institution, American Canadian School of Medicine / ACSOM, because of the things I learned and wish I had different when I was a medical student. And I didn't have as many options that are out there for choices for medical schools. And I wanted to ensure that people who want to walk my pathway that I went, I always wanted to be a physician, but my MCAT scores were not the greatest scores to get me into the limited number of spots, but I had great grades. And the AAMC, and you can see this on our website, basically says that 80% of the applicants that apply to medical school that don't get in have the grades and the scores to be successful doctors, meaning it doesn't make a difference where you ended up ultimately starting your career. Where you finish it is a MD licensed practicing physician in the US and or Canada. A little bit of more background to me and why it's so important for the social mission of establishing a university that was nonprofit is I was a fellow in economics and healthcare policy for the American College of Radiology while I was a resident. And I learned a lot of information, particularly about residencies, because there was a lot of changes happening in the healthcare system. And during that time, I started another nonprofit that worked with Dr. Amati here, who's the dean. And in fact, he was an attending of mine when I was doing a clinical rotation at Yale New Haven Hospital's healthcare network. And we got a relationship and we grew, and we I learned a lot from him, and I ended up with him creating a residency program in the state of Connecticut. So while I was a resident, I got interested in creating postgraduate medical education training, and with the help of Dr. Amati, and we worked very closely to each other. That, Henderson, I think it's better if you leave it here for us. Sorry, guys, because the screen gets distracted if it's moved. So with Dr. Amati, we created a residency program at a teaching health center in Connecticut, and that teaching health center has trained hundreds of doctors since we started that back in 2012. And through there grew a bigger passion of wanting to be able to train future doctors, because I tell myself as an interventional radiologist, I could probably train or help about 10 to 12 patients a day, excluding the imaging that I do. And if I can teach a resident, that was my first experience with teaching, then they can go and do the same thing. And after that grew this desire to want to be able to provide a better solution for students that are like myself, to go through the process, have someone who's gone through the journey and guide you and give back. And that's why we created a nonprofit, the first private nonprofit medical school in the whole Caribbean. And that's really important. And not to talk too much about the other universities that are in the region, because I did graduate from one, and you can get a quality education from a lot of places. I have a unique perspective that I learned as I was going through this process. And I'm not too far out of when I graduated from fellowship in 2015. And what I saw were large classrooms, some of which were, when I started as a student, there was like 570 near students in my student body class in a lecture hall, and there weren't enough seats for the number of students that were accepted to the program. By the time I had graduated, probably only 300 and some odd of those students eventually graduated. And right there are problems already, as you can see, when you're paying tuition for multiple years and you don't end up with your MD, let alone be able to apply to residency. That's pretty devastating, both for the rest of your life on financially, as well as on your morale and all those other things that you can imagine that could happen when you put your heart and soul into something. So one thing that I wanted also different, besides being a nonprofit institution and not having to have the university be worried about how much money it's making and things like that, was to be able to have a true social mission, just like American and Canadian schools. I did not want the university to exist in isolation, where you get your education for 2 years in a Caribbean country, and then you go back to the United States, and it's as if you never were part of this community. And I think it's exceedingly important, and the pandemic has showed us how global health interlinks with local health. And to that nature, we can also learn a lot in our early stages of our medical education with early patient interactions that you don't really get, or I didn't get when I was a student. From that, I think I'll hand it over to who else?
Well, I was going to say thank you very much for that eloquent exposition of your journey and motivation for forming the school. I don't want to bore everybody with my background, but I've been in the Caribbean medical education field now for about 15 years. I have about 30 years plus of leadership experience in medical education in the UK and the US. And for me, the opportunity to join this school was really a no-brainer. It's a fantastic project, which is in its early stages, and I'm very confident, both because of the faculty that the administration have got, but more importantly, probably the students have got, that this medical school will be a successful one. So now I'd like to ask Dr. Amadi to say a few words. Thank you, Dr. Amadi.
Sure. I'm an internist in internal medicine physician by training. I had my residency training at Yale, and also got a Master of Public Health degree at Yale. I was a program director for internal medicine residency training program at Griffin Hospital, one of the Yale affiliated hospitals, for many years, more than a decade. And then I was chief medical officer for, chief academic officer for the Western Connecticut Health Network, one of the multi-hospital systems in Connecticut, before I came here to work on the development of the curriculum of this school, faculty development, and finally being the dean of the American Canadian School of Medicine. I'm here today at your disposal to answer your questions. I will stop quickly, go to our students. I want to make sure that you have a lot of time asking questions that you want, particularly from our stellar students that are here with us.
So, Fatima, do you want to introduce yourself?
Yes, of course. So my name is Fatima, and I'm from Miami. And
That's you.
Oh.
So they can hear it.
Okay. So my name is Fatima, and I'm from Miami, and this is currently my second semester. So I am about to complete 1 year on this beautiful island, and it's honestly been an amazing time just being here.
Thank you, Fatima.
Thank you, Fatima. Daniel, do you want to?
Hello, everybody. My name is Daniel. I'm from Ontario, Canada, and I'm in my first semester, just completing my first semester here on campus. It's been a wonderful experience, and I'm looking forward to sharing answering any questions that you have.
So I think one of the things that I've experienced in speaking to applicants is what makes us so sure this school is going to be successful, because obviously for someone to take that step is a risk, which we have to be open about. Dr. Mahdi, do you want to say anything about the history of the curriculum development here?
Certainly, we have been developing this curriculum with help of Dr. Jeff Wong, the former Associate Dean of Penn State University, and a number of Yale faculty have been involved in developing this curriculum for nearly a decade. So it's not something that came about a few months ago or a year ago, even though the school in current form and state is only about 1 year old. Now, the testimony to that is, of course, the accreditation organizations that came and looked at us. You can see how quickly we had, for example, from a IAAR, which is a WFME approved accreditor, a full 5-year accreditation. It's very difficult to get for any of our competitors or an international school so quickly. Our ACCM accreditor, who's out of Ireland, also has given us a preliminary accreditation according to their protocols. You can see that we have pursued 2 WFME approved accreditors and not one, like our other our other competitors. And it is because of the certainty that we have about the quality of the curriculum, faculty, and the medical education that we provide to our students. Looking at our website, you can see the number of faculty that are involved here from Ivy League institutions as guest faculty, and they serve in various parts of the curriculum, interact with our students. In fact, earlier today, I just was asking our students how that was going and how these guest faculties are doing with them, and they were telling me they're amazing. So we really are getting amazing feedback from our current students. We are seeing in front of our eyes that they're developing beautifully. We have a great track records for our accreditors. What we don't have, and we can't possibly have, is the step 1 performance record, because our first cohort is not due to take their step 1 for another year, and there is nothing we can do about that. The ECFMG has given us their sponsorship note, meaning that our students can take that exam in 1 year from now, and I hope to be able to share with you that record. I am excited, and I believe that our students will do very well. This is observation of someone who has been, a medical educator for 30 years and have seen Yale medical students firsthand. I believe our medical students are very strong, they're very talented, they're developing very well, and they will pass their step 1. And I hope that you choose to join them and be part of this really vibrant and exciting community.
One thing I'd like to add to what Dr. Ahmadi said, because as we created this program, was to give feedback of what the experiences were that I went through as a Caribbean medical student attending one of the large Caribbean schools. And I never finished my thought there earlier, but I didn't want large classrooms where we're all sitting in a lecture hall. We learn by interactive talking like this, and even more interactive basis by fully integrating, not in the traditional sense of where you go histology, microbiology, immunology, pathology as separate courses, and you get taught those in PowerPoints by PhDs, or in my case, even veterinarians sometimes taught us pathology. And I didn't want that to happen. I wanted the university to be an affordable place with modern education, just like as if you were in my hometown of Houston or wherever anybody else is. And with that, we created the small classroom model. And I think the students can talk a little bit about their experience more than I can about how this classroom study model is and the way you learn and how you prepare for class. And it does result in a more robust understanding instead of rote memorization of some of the experiences that I had when I was a medical student. So I just wanted to add that piece in there, because that's something you'll feel that's markedly different than if you attended a large university, even in your undergraduate. Like I went to University of Texas, so I had 600 people in my organic chemistry class and made organic chemistry very hard. But for instance, one of their modules is attack and defense. Like you don't generally see that as a book or as a topic, but in fact, it integrates all those things that I just talked about into cases and ways to remember things. So then when you get them on your board exams, it's not you're cramming for that 6 weeks before USMLEs or whatnot. It's being ingrained in you throughout. And I like to address one other thing Dr. Ahmadi mentioned is, You know, we haven't had our first set of students take the USMLEs, but they are taking the National Board of Medical Examiner examinations. Those are called the NBMEs, and that's how they get tested on and quizzed on, along with other platforms of learning education that we have. So what is that? Those are common data question banks that come from the National Board of Medical Examiners to reflect the type of questions that you would get on your USMLEs. So as you're preparing for the ultimate graduation of preclinical years and taking your board exams, you're constantly taking board exam style questions. So you know how you're doing against everybody that takes the NBME tests throughout the country of the United States and Canada, or anywhere else that apply it. So you're not just being graded or know how you're doing against, let's say, these two students. You're really finding out how you're doing against the other 20,000 or so odd people that have taken that question or used that database set. So that's an incredibly important tool towards your passing of your step ones. So I'll hand it back over to you, Stan.
So Daniel and Fatima, Dr. Bagherpour mentioned this really quite unique approach to our teaching and curriculum, which is a fully integrated, systems-based, clinically relevant one in its design, based around a flipped approach, which means you've got to do an awful lot of work before you come to the classroom and be prepared to participate. So maybe each of you could share, your experience of that so far. And the other point that Dr. Bagherpour raised was the fact that we're not using our own faculty authored questions for so-called high stakes assessment. We're using a fully independent National Board of Medical Examiners question bank. So I'd like you to also both comment on that part of it as well, if you could. Daniel, you want to go? Ladies first.
As of part A, the small group, the entire idea of the small group is honestly one of the best ideas that the school can possibly have to offer. We learn in different ways, and yes, we do pre-work, but one of the best parts about the small group is that we're applying all our material clinically, so we're seeing how we're going to see it in the real world. So, and it really helps with active recall. Everyone talks about it. We have an active group discussion, and you get to kind of get an insight from your peers, and you get to put everything together along with faculty who are, you know, they've done step one, they're practicing physicians. So it's honestly very helpful. And then as of for the second part with the NBME questions, that is something that I love, because step one is something that everyone is so scared of and worried about because we think it's such a difficult exam. But being here, I can confidently say that it's something I'm not worried about, because every single day we're preparing for it. We do questions through various resources on a daily basis, every morning, every Fridays, and we're prepared nonstop with questions. And we actually just had a guest lecturer this week, and he told us, he's like, I hope you guys know how lucky you are to be, like, to have this kind of resources, because it's all about questions. And he literally told us that the key to success and just having knowledge is through questions. And we do that every day. So I couldn't be more thankful.
Yeah, and just piggybacking off of Fatima, so we do formative assessments or practice tests every day. So every day in class we have a test, and we go through the questions together as a group. The groups are typically about 5 or 6 students, and in my class, for example, we have about 2 professors typically every day, which is amazing. So 2 MDs in the class with us, and we're going through the questions. Beforehand, we're going through, like Fatima mentioned, we're going through pre-work. So we're learning about what we're going to discuss the day after. And then we do the problem-based learning. And this has been a phenomenal experience for me. Personally, I think that I'm really able to retain information, and I'm actually feeling really confident about the step. Like, I feel like I'm going to be able to handle this really well.
Yeah. So, one of the reasons that I thought it was important to create that was because we've all been in a classroom where someone's just showing you a PowerPoint, then your phone text message comes in, you get distracted. Now you just missed 3 questions on the test. Who knows? And more importantly, you're not just learning exactly what you need to know for the board exams. You're learning it for your own clinical practice. But when you get to the wards, your second 2 years of medical school, you've now had these processes of clinical patient presentations, and you're going to remember it down to the clotting cascade if you're learning about like von Willebrand's disease or some sort of some case they may say your patient presents with a clot in the leg. You're thinking, what's the diagnosis? They go, the diagnosis is DVT. Now, what could be the contributing factor? And they give you some questions. Like, you can take it to second and third level thoughts because you're learning in not a first level thoughts. You're always working in how do I take this to fit in within the entire scope of clinical practice, which I think is important. I mean, I practice medicine still routinely. My family are all physicians. My brother's a former program director as well in interventional radiology. So all this stuff I thought would be the way that you can integrate your learnings that you start at your beginning of your educational career all the way through your residency and your practice and your life moving forward.
You want to add to that, Fatima?
Yeah, it is exactly what he said. The clinical relevance and the second and the third thought process that you said, we actually practice that all week. And I feel like our confidence with the guest lecturers that have been coming in and the advice they give us and the clinical correlations they give us, it's absolutely, and we're able to answer these questions, like clinical questions that they're giving us, we're able to answer it. And we can, if they tell us a clinical case they've just experienced, we are able to figure it out and narrow it down to what this patient had. And I feel like it's something we're very grateful that we can do that at this level.
I think a unique piece of this curriculum, as the students and everybody in this room knows, and I'd like to convey to everybody else, is this is a school created by physicians for physicians. This is not a school created by PowerPoints and only PhDs and someone who's an expert in microbiology or an expert in pathology. These are real life, we're all MDs that are teaching, and our goal is so you can apply what you learned today to 20 years from now. It's not about what you can do just for your test, because you're going to do well on that test. Like when you want a residency position, and I'm sure we'll get questions about this, the three things that are very important are, one, you did what you needed to do to get to where you're at in your clinical rotations. Two is you work really hard and the people you work with like you, because those are likely the people that'll hire you, because a residency is a job. And three is networking. And because our sizes of our classes are fairly small, I mean, average size with the U.S. medical school, but not as large as some of the large schools in the region. Our goal is to provide mentorship to our students. So as they go on to their clinical years and start deciding, I want to be an OBGYN, or I want to be primary care, or let's say subspecialist. If you look at our adjunct faculty list of 40 some odd faculty members, many of which or almost all of which are from academic institutions currently, they serve as associate program directors, some of them program directors, and others who are just deeply involved in medical education. You're going to have the opportunity to have a mentor assigned to you and guide you through the path, which is really important, because when you start applying to residency programs, you don't want your score, it's pass fail on USMLEs now. Like, that's not your differentiator. Your differentiator is your letters of recommendation and who's willing to go to bat for you and how hard you've worked to get to where you are. Because like I said, you can go from here to any place that you want to go and whatever you want to do. What my goal is, and our institution's goal is, to give you all the modern day tools at a low cost with subsidized scholarships and financial aid that's aggressive, and to give you competitive loans that aren't, going to leave you saddled in debt, because I was there. I think I left I left Ross University by the time it was all compounded and all the deferments and everything, with roughly $500 and some odd $1,000 in student loans to repay. And I didn't want that to happen. And I think both of our students here can account for the amount of scholarships that we give out and amount of care and nurturing that we want to have in our community, because our goal, again, this is a nonprofit, is to ensure that we produce high quality physicians. And with that, I think we went about halfway through our time here.
Yeah.
And we should probably turn over to questions, if that's all right.
So there's a couple of questions which have come up. The first one I want to address is, I think, from someone called Prabhakar, who's online, who is telling us, is MCAT a requirement? And all I would say on that, before perhaps asking Dr. Amadi to chirp in, is that our basic requirement for direct entry to the program is a degree and an MCAT score. But we've just recently announced some exciting news, both for people without an MCAT, and also the fact that Prabhakar is saying is a pharmacy graduate. So, you know, our admissions team will work with anyone who is interested in applying on a personal level. And I think our online helpers will put on the contact details for our admissions team. But Dr. Amadi, do you want to talk about admissions in general?
Yes, I think if someone has a pharmacy degree and no MCAT, the best route is to engage us in our prep course. We have a prep course now starting this next August that will be 1 semester long, will prepare you adequately for the regular entrance into our program, does not require you to have MCAT, and is really perfect for people who have a degree in things like pharmacy, nursing, or other healthcare fields and areas, public health, and so forth, so that they can come and really prepare that first semester and be ready to enter the regular program. I recommend that to all of you who are in the same situation, same shoes as Prabhakar, to do this, to do the same.
Okay.
So just to really be clear on that, you can't apply the admissions committee if you don't have an MCAT. They have a program available. It adds essentially 1 semester to your studies, and that prepares you for your first semester. It ensures that you can get through the first semester, and then you move into that program. It is a requirement. Without it, if you don't have an MCAT, just a second, what Dr. White said, you don't have direct entry into the 4-year medical school program, but you have a pathway without having to take the MCAT, that prep program, to get you into that first semester. And that goes back to our mission that if you are looking for a career change, or but you have what it takes to become a physician, we'll provide that opportunity for you. And that information is also available online. And at the end, we'll share everybody's contact information that you need to get in touch with us. And I'll share my cell phone and my email for this school. So if anybody wants to have one-on-one discussions with me at any time, they can schedule that through our office, and we'll do that for you, as long as I'm not in the clinic or I'm available. All right.
So Daniel, Fatima, do you want to comment at all on your experience of the application and admissions process? How did you find the school in that respect?
You know, if I can throw it to one word, I would say that you really feel like you're being taken care of. Like, you know, you get an admissions counselor, and they're kind of guiding you through the process, and they're working with you. The key thing is that they're going to work with you to figure out what you need to do, and they're going to make it very easy for you to get to where you need to be to get into the program. So I don't think you have to worry too much about it, but I think like you will feel taken care of.
Anything to add to that, Fatima?
It's everything he said. You're definitely going to be taken care of as long as, you know, you apply and you do your part. And the admissions committee is actually very active at responding and helping you out. So you're never left lingering, and it's a very smooth transitional process when it comes to the application itself.
Thanks. And the next question we've got is from Sierra, who is asking, how is the school planning to become integrated into the Dominican community? Have we considered students doing practice rotations or hosting clinics for locals? I think that will help students have a better appreciation for the country while gaining valuable experience. Well, Sierra, I don't think you could have put our mission more clearly, really, in terms of our commitment to making a positive impact in Dominica. And that's already started. Even though we only took our first class in last August, our students have already been involved in community health outreach projects, doing health fairs in the community, doing health screening, taking health information, and providing health education information. But before I hand to Dr. Amadi to talk more about this and the future plans for our engagement in Dominica, how do you want to comment on your experience with these outreach opportunities? Fatima?
So we've participated in quite a few community outreach, outside, and we've had an amazing time participating and getting to know the people and the community itself. And it's been a pleasant ride because they've welcomed us, and they felt comfortable to share with us and trust us to be able to take their history. We've had Diabetes Day, we've had a World Health Fair Day, and they've all celebrated with us. And, they spoke to us like as if we're family, and they were so comfortable. They even brought us presents. And so it was very welcoming and it was a lot of fun.
Daniel, what was your experience?
Yeah, so in addition to that, we also sponsored and actually competed in a 5K run just a couple of weeks ago. I was one of the runners myself, and it was a great
Good job.
experience. Yeah, and it was in conjunction with the Diabetes Association here and the pharmacy, the Jolly's Pharmacy. They did the run, so it was a really great experience. And we sponsored the event. We were one of the co-sponsors, and again, I participated in the run. It was great.
I think I'll let Dr. Ahmadi just comment here also, but this leads to a bigger question of our community health initiatives and the programs that we have and that we're developing, and the future things that we're also building upon is providing a clinic to the community and providing the resources of our physicians to the community. Again, the difference with the university is that other medical schools in the Caribbean, traditionally their physicians don't see patients. If they have physicians on the faculty, their only role is to teach. Well, if you go to a US or Canadian medical school, every physician, unless they're tenured and retired and all they're doing is teaching now, will spend a significant amount of time treating patients. And that provides a unique perspective to students, because you can have a real clinical application of something. And that's when you do retain it. And the community health piece, I think we might even do a separate webinar, because we have some faculty here that are quite involved in that. Dr. Ahmadi, you want to say anything else about that?
No, I think you guys all covered it. I think that we do have plans for a free clinic here on campus, and it's progressing very well. Our original curriculum planning was such that the students start their first year with standardized patients and the community health work that they described to you. The standardized patient interaction is both real standardized community patients here in the simulation center, as well as a cyber patient experience where they have sort of a simulated web-based patients that they manage. But those kind of activities fill up their first year. And then during second year, at some point, they are in that free clinic with their faculty, who, as we speak, are completing the process of their licensure on the island. I believe some of them have completed that. Dr. White is following and tracking that much better than I have been. And some are in the process of getting that licensure. So according to our curriculum, at some point, they would also add that 1 day per week or 1 afternoon of clinical activity per week to their daily routines, both student and faculty together, of course. So yes, we are very excited about it, and we are integrating very well to our local community. Here you go.
Thanks, Dr. Ahmadi. And I think the only thing I would add is that a lot of the community involvement that we're rolling out is in consultation with Dominican stakeholders. So we're having discussions with local health teams, other areas of Dominican community health awareness. So we're really doing it in partnership with the Dominican people, not just our own agenda. I think it's an important point. So there's a question from Aya Gissan, I think, which is, can you expand on the mentorship aspect and its benefits, please? So all I'll say is that with a student to faculty ratio of less than 10, you from day one, begin to build a very strong relationship with the faculty who are responsible for your teaching and learning. I don't know whether
I think
you
we
want to
should
say
let
something
the
about,
students
or-
mention, about their experience in these clinical science years on mentorship, really what they're getting from their faculty. And then me and Dr. Amadi can talk about when you get into your clinical years, what I was talking about earlier. How does that, and then moving on throughout the rest of your lives, there will continue to be that friendship and support.
Yeah, so perfect examples today, we studied in class ankylosing spondylitis, and one of our professors is a rheumatologist, and we're able to get very good understanding of that condition from her. And like, I think the professors are really able to coach us and to kind of steer us in the right direction clinically, so we understand the conditions that we're studying.
Fatima?
Yeah, the mentorship, it starts honestly from day one itself, because we're such a small group itself. And it's not just what we do in class and, how they provide us with the information, how we discuss it. It's also the time they give us even after class. The fact that, we send them one email, and if you need help with something, if you just want to sit there under their presence and answer questions, they're available to help you. They're available to provide you with the constructive criticism that you need so that you can build character and become, the best possible physician, and, just be like good student, I guess. So it's definitely good mentorship.
So I'll add on a little bit about their mentorship that they're getting right now. And then what you will be getting when you get in your clinical years. Even to understand, you have full-time faculty here that teach and they live here in Dominica, and those are the ones that will be available all the time to you. And then weekly, as been mentioned before, experts in their various fields of medicine from North America, both from Canada and the United States, come down and teach on a rotation basis, 1 to 2 week blocks. And you get those lectures early in the morning, and they provide you opportunities now to build relationships with doctors in fields that you may not even know much about. I think more recently, I just heard that one of the lecturers that came and taught this week already reached out and said, I'm available to read.
Yeah.
Can you guys tell us a little bit about that? There was something that actually happened today in real life.
Yeah, so we had a guest lecture this week actually, and even the week before, we've had two great physicians that they were really surprised with what they saw, and they sat through all our small group sessions, and they've personally asked us to email them and to be a part of their mentorship and to learn under them. And it's been honestly like something we're so thankful for, because there's so much to learn from them. And even the smallest stories that they share with us, there's so much to learn. And it's honestly the greatest thing, because you just see that they want to teach you, and there's it's honestly something that we're so thankful for ultimately.
Great. And specifically now, I think that the question they had a little bit more questions in regards to guidance through the medical school journey and going through completing your step ones or your Canadian boards and then obtaining residency. Dr. Amadi, you want to take that?
Yeah. So what happens is that the first 2 years they covered, so that gets you to this step one. And toward the end of your second year, we have a very extensive program of USMLE Step 1 preparation, even though you have been preparing for it throughout the first 2 years. But there is also an intense preparation toward those last days or weeks that leads to you taking the exam. Beyond that, you then enter your clinical year, and the first clinical year, your year 3, is essentially your core rotations are in internal medicine, family medicine, obstetrics and gynecology, surgery, psychiatry, and pediatrics. And these rotations will determine to a large extent your final destination, because you enter the medical school thinking that you want to become a surgeon or you want to become an obstetric gynecologist. And then over the course of your
Maybe 5 other things that I
Oh,
wanted
5
to
other
be
things.
before I landed on radiology.
But once you finish your those core rotations, you have a very good understanding about your capabilities, your talents, your interests, your passion. And that is when we engage you in one-on-one discussions. It's me, it's your campus dean, and also your clinical dean at that point, that will start talking to you. Okay, now you have decided that's what you want. What you wanted from the beginning is also what you want now, or maybe you have changed your mind. You want, let's say, maybe interacting with me have convinced you that you want to really be an internist, or interacting with Dr. Bagherpour here has convinced you want to be an interventional radiologist. Regardless, this is a point where your electives are now going to be planned around that. We together will plan those electives in such a way that will maximize your chance of getting to the residency that is your top choice. So I'll give you an example. Let's say you want to do interventional radiology. That's what you have decided. Well, there are a number of program directors in interventional radiology that are close and work with Dr. Bagherpour, and we're going to make sure that you do several of your electives in your senior year, 3 or 4 of them, with every one of those program directors. That's how truly you increase your chances of matching, because those programs become then the prime target for your residency match. Your interaction during your elective months gives those program directors and faculty a very first-hand experience with what they're going to get if they match you. So, and you are trying to get that position. So I know you will be on your best behavior. You will work very hard. You will try to shine in those programs. And that's how ultimately you match into one of those programs. So this is a continuous process. It starts pretty much with your experience during your 3rd year that will give us a sense of the target, that what is it that you want, and that where is it that you want to match, and then we proceed from there.
I think just to reiterate one thing is that this advice and this model is built from Dr. Ahmadi's background of over 15 years as an internal medicine program director at a top university hospital system, who did take a significant amount of international medical graduates into their program, who went on to become primary care doctors, and even fellowship trained cardiologists, GI doctors, you name it, infectious disease. And I've seen that firsthand. And so the information that's coming from is not from theory, like you may hear from other universities where they're just saying, oh, somebody's talking to you about it. You're getting information for a person who lived it and went through it. Likewise, when I talk to you, I went to the Caribbean schools, I graduated from it, and I practice medicine now. And I think when you're talking to someone, you should demand that people who have experienced it are talking to you from a place of knowledge, not a place of theory.
I just would like to add that, in fact, some of our guest faculty are my former residents who were international graduates, and they did residency with me and went and got their subspecialty training in endocrinology, cardiology, for example. Those are nephrology. Those residents actually and are now specialists in the great university systems in the United States. And they have come back. They came back. They interacted with our students here. They have been providing mentorship, and so it's a full circle of getting back that experience. So you know that as an international graduate, you will have the highest chance to hopefully match to your top targets.
So the next question is from Ben, and I'll paraphrase it because it's quite long, but it's essentially asking about a very talented student at age 19. And being so young, how will ACSOM really support someone of that young age? And how do we ensure and support learning service as well as safety equity? So
I think I could just kind of start that. And then, I don't think the age of the student makes a difference. The maturity of the individual entering a program and the educational background. Obviously, if you're obtaining your bachelor's of science in biology at the age of 19, you've achieved the things that you need to do to get to that phase of being effective in school. The bigger thing that I think is important to understand for everybody on this webinar and in the part of the community is that we're a safe environment with student housing that's all around campus. You're not going far away. If you look at my current alma mater that's in Barbados, their drive from student housing to the campus is 35 minutes. Our location for student housing to the campus is a 5-minute walk. So it's like just walking the campus, which is 30 some odd acres. And it's safe. And I think that's a very important thing to know. The university has great security, like any proper university, but you're not ever going to have to think about it because you're in a safe environment. Additionally, food, there's all sorts of food that you want. I eat fresh fruits and vegetables and fish and things like that. And in fact, when I lived in Dominica, I probably lost 25 pounds because I was eating pretty good and healthy. And but they have food for everybody. And then as far as like, if you want to go, if you're religious, you go to church. There's churches here. There's a mosque here. And I think there's some non-denominational stuff. So you have the community to be part of. And community, I think that's the biggest important thing. And students here, I'm not going to speak for them. I'll let them talk about the community that you all live in, that you experience daily, and the student services that you have available to you, because student services is a big piece of this community life.
The community itself, it's very opening. As I mentioned earlier, they honestly welcomed us with open arms. They help us out. Even the local stores that we have around here, ever since we have attended campus and they've seen students around, they've been modifying their store. They're building a cafe, and they're bringing stuff from the States, and they ask us consistently, hey, is there something that you want? Is there something that we don't have here to offer you? And it's very safe. Like he mentioned, we have perfect security. They're available for you 24/7, and it's a literal 5-minute walk anywhere you stay for housing. And there's security by every housing also. And it's never a fear. Like, it could honestly be 9 p.m. and I can walk and I'll be fine. Like, I'm not scared. So honestly, very
I think you can't say that about very many big cities in the United States.
You cannot.
Yeah, please.
I'll be very quick. Yeah, so just to piggyback on that, I was really surprised by how safe this island was. Like Martin was mentioning, you could walk at 10 p.m. and not even be worried about it. But also, security on campus will actually drive you home, or they'll drive you to where you need to be. They're very responsive to the students. There's been times when it's raining and they'll come pick you up. They'll come to your apartment, come grab you, and bring you back to campus. So you're gonna feel supported. Like you're gonna feel like you're at home. And I think it's really important that for you to know that, like, you're gonna feel like comfortable when you're here.
And just to, well, go ahead, Dr. Mahdi, and I'll close this so we can move on to the next question.
They talked about safety for you and how you will be kept safe and supported. I just wanted to comment that, okay, at the age of 19, if you have a bachelor degree and you're starting medical school, you are very young. And there is certain amount of maturity and worldview with in terms of learning to communicate or learning about various things in the world that comes with experience. And the school does have an introduction to clinical medicine program as a part of the curriculum that does have if you will, a hidden curriculum within it. That hidden curriculum talks about ethics, talks about skills of communication with patients, talks about humanities and the role of the humanities in medicine, and brings various aspects to the table for you that will allow you to grow and to become more experienced and more mature as you spend your 4 years with us. So I believe we would be able to help you to become a very seasoned young physician at the end of the 4 years with us, and maturing in other areas, not just science, but developing life skills, communication skills, and an appreciation for other fields other than science by the end of your education time with us.
I think that's very well said, and that applies to anybody entering the medical school. And I myself, I'm doing an executive leadership course right now at Yale School of Management, and learned a lot. We spent some time at their medical school, and it's very attuned with what the creators of our curriculum, who come from those communities, created. So very well said for everybody. Thank you. We'll move on to the next one.
So since the next question is directed at you, Dr. Bagherpour,
Oh, great.
which is, and you've got the mic, you mentioned taking internships and fellowships. How does that actually work in the program? And is there a body that students can work with for internships and fellowship opportunities?
I think that question probably needs a little bit more clarification, because you will not be in your internship or a fellowship while you're in medical school. Again, to clarify, you have 4 years of medical school unless you do one of the prep programs or to get in, which I had just an extra semester. But you have 4 years of med school. 2 years of that are preclinical years, which isn't really a fair statement because you get clinical experience in your first 2 years. And then your second 2 years are in the hospital wards. And from there, then you apply for residency. And depending on if you're going into a subspecialty or a straight residency pathway, you have an internship year, or you're considered an intern. So that could be your first year. And regardless of what field you are, surgical intern, internal medicine intern. Now, fellowship, depending on if you go to internal medicine, being 3 years, and the array of fellowship opportunities start after your residency, and generally after you get board certified or you do your board certifications in your residency time. So for me, I did my fellowship after I finished diagnostic radiology, which was 4 years, and I did a 1-year interventional radiology fellowship. So I hope that explains some more. And I'm happy again. I think we're going to have a webinar that's going to talk specifically about residencies and a podcast. So we'll be inviting program directors from various organizations throughout the States and Canada to be able to field your questions, and for us to give you our input on what it takes to get a residency, and from all different perspectives.
The next question is from Debbie, which is, what if you have no medical experience or background, which I assume is in relation to actually applying to enter the school? So again, Dr. Mahdi, do you want to say anything about prerequisite?
Having a bachelor degree and having taken your MCAT, those are what are the requirements for admission. If you have a bachelor degree but haven't taken MCAT, or you feel that your science courses and backgrounds are not adequate, then I recommend considering either our prep program, which is 1 semester. That's mainly if you have had some background in health profession. If you haven't, let's say you have a bachelor degree in history, or my favorite, literature, because that's what I had before going.
Mine was history.
Yeah.
Yeah.
And so I did history, actually Russian history and Russian literature was my background before going to medical school. So if that's the case with you, I recommend we have a pre-med program, also a 2-year program that we are putting together, actually this year for next August, to have you prepare adequately for a medical school program. You do chemistry, physics, and biology and anatomy, and sort of the courses that you didn't have to take to that extent when you were studying, let's say, Russian literature. And then you, after those 2 years, you do take an MCAT and you enter the program as a medical student of ACSOM.
So I
They
think
have
just
that.
a key differentiation, so nobody gets confused on the web chat here, is that if you, like for me, I was a history major in the liberal arts college, but I did do my prerequisites. I took genetics, biology 1, biology 2, and that, you know, all those prerequisites, you still apply, you can apply, and you took your MCAT. So the question's a little vague, whether if you have any academic background or actually experience in the field. If you already did the academic prerequisites, regardless of what field you're in, or you took the MCAT, you know, the admission advisors will work through that with you and plug you into the right program. So we're not confusing people, but we have the pathway for different people.
Thank you. So the next question is from Adazi, which is, how does the school support or provide resources for students who plan to relocate to the island with spouse or children? So, I mean, I can just very quickly,
Stan, would you like to do that?
say that as soon as a student is accepted into the program, our student services team will begin reaching out to every one of you. They provide a number of so-called pre-departure orientations, and they're always available to answer questions such as the one that you've just asked. We do have at least one student who's here with his spouse. We don't have any students here with children.
But I could talk about that with my experience, and we have faculty with children.
Of course.
So
yeah.
And they said that's no other students.
yeah, so there's students with a spouse. When I was attending school in Dominica, which again, I should say, this country has graduated over 20,000 practicing physicians in the US. And so with that being said, an infrastructure within the community is already in place, in addition to what student services and everything will provide. If your children need to go to school, we have schools, depending on the age, student services, we'll talk to you about that. And all the different pieces about relocating for everybody will be handled by student services. And you can talk to them in advance to your application, during the application process or after, but those opportunities are there for you. I mean, we're a very close-knit community.
Yeah.
But students, you should comment on that question, I think, but you have experienced it already, and that's what they're asking for.
I mean, in specific terms to your question in regards to spouse, I do have a classmate. He's here with his wife, and she's settled in pretty well. There's housing available that fits your comfort, and like Dr. White mentioned, through student services, you can always get in touch with specific students per se that are experiencing this currently. But as far as we go, it's a very close-knit community. So even to be here with kids, your kids will be taken care of. There's we've spoken to the community. There's schools, there's daycares. It's a very safe environment, and there should be absolutely no problems with that.
Daniel, do you want to add anything? No? I mean, I would just add that two of our faculty members do have children here on island. They located one couple from Russia and one couple from Nigeria, in fact. And all of their children are attending actually the same school in the same village, close to the school, and they're having a great time. And as Dr. Bagherpour said, there are other schools in the area, and student services will help facilitate that sort of journey for you. How long is the program, including residency?
I'll answer that. The program's 4 years. It's 2 years here in Dominica, actually less than 2 years. It's about 20 months, but it's 2 years. And then it's 2 years of clinicals. So that's what medical school takes on a traditional pathway. Residency, depending on where and what you want to do, mostly what, that's a different frame. Your internal medicine's 3 years, and then your subspecialties can go longer, or if your fellowship. So when we have our webinar about residencies, we can go through some of the basic stuff. If you had a specific program, we can talk together offline and answer any of those questions for you.
Okay. Any more questions, Henderson? Is there a teaching hospital in Dominica? if so, are internships offered to graduates from the Caribbean? Well, there is a major hospital in Dominica, which is currently undergoing an accreditation process of its own with a Canadian accreditor, and it hopes to become a residency training program. We actually met with the management of the hospital just yesterday. So currently, rotations of types do go on in that hospital for students and graduates from a number of other schools, but not so far us. But do
No, I think that the most important thing for you to get away is that your heavy clinical experiences will occur at your U.S. or training site, and soon to be a Canadian one, and other ones that are coming online. And that's where you're going to get your most number of hours per day, more than you're ever going to want occurring. But in your first 2 years, you will have clinical experience that is tailored for you to be able to get to that level.
So Ben is asking about scholarships and financial aid. And again, I'd just say that there's a lot of information on the website. Financial team are always contactable, and those contact informations will be put up on screen. But we have a wide variety of scholarships, which Dr. Bagherpour can talk to, as well as our own student loan program at the moment, with new ones hopefully coming online in the near future. Do you want to say something about that?
Yeah, I'm not going to talk about each individual scholarship. Those you will, when you want to talk to the finance and financial aid, excuse me, and when you get accepted, that they will offer you a scholarship. I think every student has a scholarship, merit-based as well as needs-based. There is a goal for everybody that can qualify to come to the university to be able to come to university, and finances not to be an obstacle. And I think that students could talk about, how we ensure that that occurs. In addition to that, we have financial aid. It runs along the same lines of the Graduate Plus program served by the U.S. federal government, competitive rates, and we'll plug you into that for any differences that scholarships don't cover. Many of you on this webinar may qualify for honor scholarships that may get you a scholarship all the way through for the 4 years of school. You don't know until you apply. So I'm not sure when they're going to ask everybody to apply, but I'm going to ask you all on the webinar that it's important to apply. You won't know what you have until you ask for it. And if it's not enough, and you say I have different needs, our financial aid department will work with you to customize a program that works for you. So again, I'm going to ask to give us the privilege to teach you and for you to go ahead and apply.
What kind of immigration requirements are needed for Canadian citizens?
We have a Canadian citizen here.
Yeah, so I'm from Ontario. It's really straightforward. You actually, when you get to customs, you just fill out the form, and then the school will help you with the process of completing that visa. But it's very straightforward, nothing to worry about.
Easy, very easy.
So, are there plans still in place to have clinicals occur in the LA area hospitals, or has it been changed or been updated?
Well, I'll mention on the first part, and then I'll let Dr. Amati talk about the second parts of additional clinical sites coming on board. There has been no change in our clinical sites. You could see them online: Hollywood Presbyterian, Los Angeles Downtown Hospital, and one other of the hospitals within the community over there, where they're all under what's called Green Book. That means there's a residency program associated with each teaching rotation, so you gain credit for that. But with that said, we're actively pursuing additional high-quality clinical sites. We do not want to have 10, 20 clinical sites, which you may see in some of the large schools. That's where they get into problems with accreditation, and you can go read online about the issues that have been surrounding that for many of the Caribbean schools. That's why we're going to be very controlled in the way that we provide teaching to our students. So Dr. Amati, you want to add on to that?
No, exactly. I agree. We do have our sites in LA as you see them described on our website, and we have new clinical campus sites that we will be announcing hopefully in the next few months. Our current student group is still 1 year away from their first clinical rotation, more than 1 year away. But we believe that in the next 5 to 6 months, we will finalize our main clinical campus sites in addition to the ones that we have announced in LA.
Well, it seems that we've answered all of your questions up to now. So I think if there's no other late breaking questions, I'd just like to thank Dr. Mahdi, Dr. Bagherpour, our students for providing you all the information that we hope has persuaded you all to get on the website and apply today. But most of all, I'd like to thank everybody online who's participated in this event. So do you have any parting words?
Thanks, Dr. White. Thank you, everybody, for coming. I just want to, I mean, I don't know everybody on the other end, but if you have a dream of becoming a doctor and you've hit a roadblock, I was there. I went through it. There's no reason that roadblock will be permanent. It's just a detour. And there's a reasonable pathway that someone has walked through, and that's me. And it took me 15 years to walk through that pathway to be able to say, I think this is how it should be done. And it wasn't too different or an outside idea to say it should be done to the same standards in the countries that we are coming from, the United States and in Canada. And so our program was created like that, in light of that, made by physicians for physicians. And I would be incredibly honored, and everybody else part of our team, to have you part of the first private nonprofit medical school in the Caribbean that will be able to serve you right and provide you all the opportunities that you deserve, because you have the grades to achieve it, to become great physicians. And thank you for joining us today. Every week we're planning on having webinars on different things, and your advisors are also available to you to contact me individually or Dr. Ahmadi. And if any times you need to speak to a student, you want to get some information, we got to just be cognizant of their time commitments, because they're pretty busy with school. But we will make ourselves available to you, talk with your family. So will all the student services people that hold regular webinars. There'll be podcasts coming your ways and things like that. But I do encourage you to apply. There's only a limited amount of scholarships. When they're done for this semester, they're done. So please apply, capture those scholarships, get your honors scholarships, get your merit-based scholarships, and let us get you started on this journey and not delay what you should and can achieve. And there's nothing that can stop you.
So on that very persuasive end note, thank you once again, and have a great remainder of your day, everyone.
Thank you.
Goodbye.
Appreciate it.